This is the Batten House Podcast, the place where local businesses and neighbors come together. Here's your host, Sean Batten.
Well, hello, Sarah. So nice
Hello.
to have you on the podcast.
So good to be here.
You are one of our awesome customers that we have the pleasure to work with. And we really are excited to have you here because you have so much to share. And so for our listeners, tell us about your business.
Yeah, so I am the clinic director of Four Wings Psychology. We're a mental health service located in the Ottawa area on the West End. We service pretty much across the lifespan: children, teens, adults, couples, and families. We're aiming to be kind of a one-stop shop so that you can get services across for everybody in the family, all in one spot. And we have quite a team working with us, and we're continuing to grow, which is great.
That's so awesome. I love it. So tell our listeners about your journey. Why did you get into your business? I'm sure it's a great story.
Yeah. So, I mean, it starts way back when I was about 12 and decided I wanted to be a psychologist.
Really?
Oh, yeah. I've always wanted to be a psychologist, which is bizarre. So I started then, and when I finished up all the training and everything, I did co-own a different practice and really enjoyed that experience. Went through some challenges over COVID and ended up having to, exactly.
Absolutely.
Ended up having to kind of pull it back a bit. And then with that, decided I really wanted to build kind of a group practice where we had a number of different practitioners all in one place and kind of invent the practice in that way. So I ended up creating what's now become Four Wings Psychology. We started off in a very small shoebox of a place that was just about 600 square feet. And now we've recently moved into 2,100 square feet, and we have, I think, 8 to 10 clinicians right now.
That's great. I remember that space, and it was a beautiful space, but yes, much smaller than what you have now. Absolutely. But I love because your heart has always, even from the beginning when we had first met, your heart was really to offer a variety of services, and what the work you do in the community is so vital, especially after COVID and just the mental health crisis that many really believe, as do I, and I know you do, that really is a part of our country right now, and you guys do incredible work with that, with all of that. There's so many facets, right?
You bet.
Yeah, go on.
Oh yeah, go ahead. I was just going to say, and we tend to focus on providing the evidence-based services. So really trying to give people what, the tools that are going to help them in terms of moving them along in the right direction. Absolutely.
No, that's great. So can you tell us about any myths or misconceptions you hear about your service, your industry?
Yeah, I could go on for hours about that. I think one of the biggest ones that I hear often is that I'm not sick enough, quote unquote, to, be needing psychological services or psychotherapy, that I kind of need to be at rock bottom, really suffering, and then I should get services, where in reality, there's so much preventative work that we can do, in terms of even just keeping things level, for people, but then even sometimes just improving things, from an already okay space. So that's one of the ones that I hear very, very commonly, when people come into my office and go, I don't know, maybe I shouldn't be here. We kind of go, no, everybody has their starting point, and you don't want to get to the point where you absolutely need to, draw on that if you don't have to get to that place.
Absolutely. It's funny you say that, because the first time I ever went to a counselor, that was my first. I sat in the chair, and this lovely lady, and she was so warm and comfortable, and That was my first line out of my mouth. I don't really know why I'm here, but I know I need to be right now in this time of my life. And because there wasn't any prevention in my mind, in my community, my circle of friends, we never talked about preventative. So I love that that's worth shouting from the rooftop and say you don't need to hit rock bottom to give you a call and sit down with one of your team members. And so you personally, so I mean, we're here to talk about your business, but also like you jumped into being an entrepreneur, which is super fun.
Yeah.
and a lot, kind of drinking from the fire hose sometimes, especially with the move and hiring people and all these different things. But on the other hand, what do you do for fun? When you're not working on your business and answering emails and paying bills and paying yourself and being focused, obviously you probably talk a lot about life balance with your customers, your clients. But what do you do for fun?
So I'm a bit of an interesting character. I tend to be a bit of a homebody, so I spend a lot of time, just kind of at home with the family. I have 2 little pet bunnies that I steal some snuggles from whenever I can. Awesome. And then I have a few activities that I love to do. So I do a lot of water sports over the summer, obviously in winter, not so much. But I also do archery. So that keeps me quite balanced and takes a kind of different level of mental focus and calm, that I found really, kind of balances me out, on a regular basis.
Absolutely, which is so vital for any industry, but especially when what you're in, because it could be so heavy sometimes, right? And so it's really great that you have archery. Wow, I never would have guessed. That is so cool.
Right.
That's so cool. Oh my goodness. So segue into, can you describe one hardship or life challenge that you rose above and can now say because of that challenge you are better for it and or stronger? Like how has that kind of possibly influenced you becoming a psychologist and also as a business owner?
Yeah, that's actually a really, really good question. I think one of the ones that really stands out for me was kind of what happened during COVID. So I had this practice, that I was co-owning. It was super successful. It was doing well. We had even purchased a location that we were, so we were kind of in our forever home, and then COVID hit. And that was a pretty big hit. We had to sell the location. I ended up practicing from, what I would lovingly call literally a shoebox or closet. I was kind of in a 9x10 room for a couple of years, just kind of sorting things out and, kind of recalibrating a little bit. That ended up being kind of the impetus for, creating where I am now and what I have now, just in terms of really, having the vision and then really implementing that. So from a place of kind of being like a kick dog a little bit in some ways, that I ended up kind of rising above, I feel like, and, building something that I'm so happy with now.
Absolutely. And happy. And I know you're proud of it and you should be, because you're really becoming such a strong pillar in the community, which is, your services are needed everywhere. And you've risen to that and you've found some talented young people to be on your team too, which is super, it's just so great for our community. Can't say enough. So for our listeners, what's one thing you wish they knew about your business? Maybe you touched a little bit about that with the myths, but there are misconceptions, but give me one or some.
Yeah, one of the things that we've just implemented with most of our providers is direct billing. So that's something that we're able to offer for a number of insurance companies and with most of our providers. But it certainly takes the burden off, and one of the barriers of going, which tends to be having to pay up front. So
absolutely. That's
great. A pretty big one. Yeah.
No, that could definitely be a deterrent. And so making it's less friction to call you and say, hey, let's chat. And that's hard enough. never mind to have to, like, it's like finding a dentist, you really, you need to do it. But no, that's great. I didn't even know that existed actually for your services.
Yeah,
That's really cool.
New and improved. Yeah.
Totally. That's good. So then how can our listeners learn more, contact you, stop by your beautiful space over at Centerpoint there?
Yeah, so they can find us on our website. That's probably the first place that to find us. So at fourwingspsychology.ca. Okay. They can also email our team at admin@fourwingspsychology.ca. And we also take phone calls, 613-435-3344. We also have presence on Instagram, LinkedIn, and Facebook. So we're pretty active on all those platforms as well.
You are. So that's good. So fourwingspsychology.ca.com?
.ca.
.ca, yeah. Okay, perfect. And we'll list that also in the description for our viewers. So listen, I know as a businesswoman, as you working in your business as well, not just on your business, you're busy. So I thank you very much for your time with us. And please reach out to Sarah and her team. She and they have just such a heart for our community, and at least have a conversation with them. Okay. Thanks again, Sarah. Really appreciate it.
Thank you.
Take care.
I really appreciate this talk.
Thanks for listening to the Batten House Podcast. To nominate a favorite local business to be featured on the show, go to battenhousepodcast.ca. That's battenhousepodcast.ca.